In this video, we will review pharmacy profiles, a part of the written portion of the New York State Board Exam Part 3. This video is meant to help prepare you for the Part 3 exam of the New York State Board of Pharmacy. It is created with the best available information provided by the New York State Board of Pharmacy, and there is no guarantee that the directions on the actual examination will be the same as what is seen in this video. There is no guarantee that the examples in this video represent the level of difficulty of the actual examination. Please make sure you read the directions carefully when you are taking the exam to ensure that you are answering each question appropriately. Part 3 of the New York State Licensure exam is made up of two parts: the compounding and IV portion, which is given on one day, and the written portion, which is given on a separate day. The written portion is comprised of three different components: errors and omissions, which is worth 20 points of the total 100 points of the exam, look-alike sound-alikes, which is worth 8 points, and patient profiles, which is worth 12 points. In this video, we will concentrate on the patient profile review. In the patient profile section, you will be given a prescription and a patient profile. The profile section of the Part 3 exam assesses your ability to identify drug-related problems when a new prescription is written for a patient. You are given a new prescription for a patient and the patient's prescription refill history. Using these two pieces of information, you must identify if a problem exists with the new prescription and what corrective action you would recommend, if any. This is an example of what you might see on the profile section of the New York State Board exam. You'll be given the patient's refill history, some demographic information, and a picture of a new prescription. Your patient is Renee Graziano. She's a female who was born in 1968. She has an allergy to sulfa drugs. Her past medical history includes hypertension, dyslipidemia, and depression. She's being treated for those with Lotrel, atorvastatin, and fluoxetine. The new prescription that is presented is Norvasc, 10 milligrams, 1 daily, number 30, from Dr. Robert Berger. Your job is to find if there is a problem between this new prescription being dispensed and the medications she's already on, or if there is a problem between the new medication being dispensed and her medical history or her allergies. You'll notice that she's on Lotrel, which is a combination of amlodipine and benzapril. So to fill another prescription for amlodipine would not be appropriate. You would identify that this is a problem, and you would identify the steps you would take to resolve this problem. For example, call the physician and suggest a different antihypertensive. In this second example, you'll notice your patient is Eva Santano, who was a female born in 1978. She has no known drug allergies. She was discharged from the hospital on March 13, 2012, following a rotator cuff surgery. You'll notice that she's on cefdinir, isotretinoin, and Yasmin. The new prescription is for Toradol 10 milligrams, 4 times daily, number 120, by Dr. Robert Berger. Your job is to identify what the problem is with this new prescription and her current medications. You will identify that Toradol is only supposed to be given for a maximum of 5 days. Therefore, the prescription is written inappropriately. The steps you would take to resolve this problem might be to call the physician and change the number dispensed so that it is a 5-day supply. There are 3 pharmacy profiles. Each profile is worth 4 points for a total of 12 points. 2 of the 4 points is awarded for identifying any problem with the profile or the prescription. The other 2 points are awarded if you are able to document the necessary corrective action. To prepare for the profile portion of the New York State exam, make sure you are familiar with medications, the top 200 drug list, brand and generic names, the appropriate doses, side effects, and indications. Make sure you're also familiar with any timely clinical issues, news, or events that have happened either in New York State or nationally within the past 6 months to a year. The New York State Board wants to ensure that it licenses pharmacists that can help keep patients safe. Timely clinical issues and events are very pertinent and considered important information for new pharmacists to know. The Pharmacist Letter at www.pharmacistletter.com is a very good place to find out what some of this information might be. For more information on the New York State Part 3 exam, please refer to the other videos on this website.